Well, it's really great. I'm Richard Van Wylick. I'm the Vice Dean Health Sciences Education and a member of SEAMO, and I'm talking to some people today about their experience with the Harvard Macy Training to Teach in Medicine program and funding they received from the SEAMO Medical Education Development Program to help facilitate their attendance at the program. So it's great to have everybody here. And I thought maybe I'd just throw out some questions for our group today to answer about um, how did you find the Harvard Macy Training to Teach program as a learning experience, and what did you take away from it, Dr. Train?
Well, I thought it was a very comprehensive program. There was actually much more that they on offer that I needed. In fact, there were so many additional lectures and supplementary talks and so on that you could attend. There was more than I could even go to, which was quite reassuring. I found that I was able to get a hold of the faculty easily, and they responded. I got great feedback on the project that I was working on, which was to develop a totally original half-day workshop. And I think the timelines were reasonable too. And I'm happy to say that I developed a half-day workshop through the help of the training program. And I was able to deliver it in July, and it's been very successful so far. So I think it wouldn't be of the quality that it is without the help of this training program. So I'm very grateful for it, actually.
Maybe I'll just throw this question out to Dr. Morrison-Levy. What did you take away from the program, and how did the funding from the Medical Education Development Program that SEAMO provided help advance your career?
Thank you. So I think the funding was very, very useful in this program. I benefited a lot from the sessions, the workshops, the facilitators. It was easy to get to them. And one thing that came out for me, I had an idea about approach to first unprovoked seizures in children. And through this program, I was able to develop a project, an interventional project, and through using my capstone, got lots of feedback. And so at this point, it's going off to ethics, and I know it's going to be an amazing project for our residents. So amazing program, and quite doable, time-wise. It's very flexible, and, there's always someone to answer your questions. So highly recommend.
Maybe Dr. Montague, I could ask you, what did you take away from the program, and would you recommend it to others?
I would recommend it. I think often we do a lot of things based on whatever person role modeled it before us. So we do a lot of medical education. I'm the program director for the GIM subspecialty and director of multiple POCUS curriculum. And this program really gave a comprehensive overview of different ways to teach that I didn't know, but also evidence I didn't know for some methods that I'm already using. So I think it really elevated the multiple curricula that I'm in charge of to really deliver it at the top level possible, which makes me feel good because I want to teach as best as possible to the learners here at Queen's. So I would recommend this for anyone that wants to know the best evidence, the cutting edge teaching modalities, so they can deliver the best cutting edge curriculum possible.
Welcome, Dr. Guerin. We're talking about the Harvard Macy Training to Teach in Medicine program that I know you attended with SEAMO. And we're just going around and I'm asking a few questions. And I'm wondering if you could share with us what you took away from the program and how important you thought it was to advancing your career.
Absolutely. So from my end, my goals were very, I think, narrow when I began. I wanted, because I've done some training previously with like education training, I wanted specifically to look at what were the topics that Harvard was highlighting, specifically related to retention of material and learning strategies. And the other piece to it was I wanted to make connections with the Harvard Macy community because it seems like quite a diverse and extensive CPD community. And so for me, it was really those two things that drove it. which might be a bit different than others. Sorry, I was in another meeting, so I'm late. But that was primarily the reason why I wanted to do it. I found I did get both of those out of it. It's a good course in that it's a nice smattering of nice selection, like a smorgasbord of all the kind of pertinent topics. It's something that I think it was good to do at the stage that I'm at, but it also would have been great to do at an earlier stage too, to just get that introduction to a good variety of different teaching and education research topics. And so it was really good for that. And I also got the opportunity to collaborate with people internationally, which was really lovely. Some of which I'm going to continue collaboration with, which was excellent people who I would never have met otherwise. So that was a very positive experience.
As all of you know, SEAMO provides funding to physicians and SEAMO members to help advance their careers and develop new skills. Maybe, I don't know if anyone wants to pipe in on how important the funding itself was to helping you get to the program and feeling like you could participate. Stephen.
I'd say without the funding, I wouldn't have dropped the 10 grand to do this course. So thank you, SEAMO. And it really has connected me to international individuals, and we're collaborating on multiple projects we're hoping to bring to publication. So it's not only advancing my career and advancing the international connections we have here, but it's also just making sure I deliver the best education possible to my learners. And without the funding, I wouldn't have been able to elevate my teaching.
Anyone else want to chime in on that one?
Yeah, I would say that the funding is key. I think a lot of us, these courses are very expensive. They you know, without the funding, you're not going to be able to afford it. So, you know, thank you for the help, for sure. I believe it's money well spent, to be honest. Yeah.
Dr. Morrison-Levy, I don't know if you might want to comment on, you know, why someone should apply to this fund if they're considering expanding their skills in medical education.
Yeah, so I think, you know, anyone who's interested in, you know, getting the fundamental tools for teaching and just learning a variety of ways for teaching and, you know, allowing our residents or our trainees to develop clinical reasoning skill. This is an excellent course. And absolutely agree with applying for funding. This funding from SEAMO was so helpful. Otherwise, I would not have done this. So go for it. Excellent course. Apply for funding.
Dr. Guerin, do you want to maybe pipe in anything else you think SEAMO members should know about maybe this fund or the application process or similar courses that might be of interest?
So I think the one thing I would say is the application is not too bad. So it's not so scary. Sometimes when you see these applications, you think, oh my goodness, this is going to take forever. And it's actually, I found it quite painless. Application was fine. The other piece about what other courses, I always find it very helpful when the fund comes out, when they have a list of suggested courses. That was very useful, especially when I was first starting out and I had not a clue who and what these courses did. That was really useful to me as well, because I've accessed this fund a number of times. I think at least twice I've used it. So that's been very helpful. And both times, the other time was for CAME. I think I attended CAME a few years back, and that was actually very useful too. And also another incredibly expensive experience, but definitely worth it in the end. Yeah, I think that's the other thing that I would highlight to colleagues is to have a look at these ones. Having the suggested list is very helpful because I don't have any other things to add to the list, to be honest with you, because I've only ever done the ones on the list. But having those there was very worthwhile and was very useful, because then I made the decision. I clicked on the links and I was like, oh, this sounds so good. Oh, this sounds great. I should do this. And the application is quite painless and it's very helpful. And the courses are quite expensive. And I would not have done either of them, to be honest with you, especially when I was first starting out and, you know, still trying to establish myself financially. I would not have done it if I had to do it on my own dollar.
Great. Does anyone have anything they'd like to add to to tell either SEAMO or the SEAMO members or others about this process and about this fund.
Yes,
This is the only.
members were very helpful. They responded very quickly to questions. For example, I applied for a master's and applied for funding for the master's, and then I wanted to do this course so badly. So I asked, will I be able to get funding for it? And I was able to get funding for both. So they were very, very helpful, walk you through any challenges that you may face. So thank you so much. I appreciate that.
Yeah, this is the first time I've applied or accessed this fund, but I would echo what you said. It's reasonably painless and straightforward. And I've only done this course, but I thought it was really well run. It was a really polished course. Lots of troubleshooting, easily available individuals with a very packed schedule with lots of different modalities to encourage us to learn.
Well, thank you, everyone. It's been great having a conversation with you, and thank you all for applying to the fund and expanding your skills in medical education. It's important, I think, to all of us that we have that, and a big thank you to SEAMO for making this available and valuing our medical educators.